Hi everybody, my name is Adiola and today I'll be presenting on Lassa fever. Lassa fever is a viral hemorrhagic illness that can be transmitted from infected humans or rodents, specifically the multi-mammoth rat. It is endemic to West Africa and it affects thousands of people annually. While most cases present with mild symptoms such as fever and headache, approximately 20% of infected individuals develop severe complications. The people that are most susceptible to Lassa fever are individuals that live in the endemic regions like in endemic regions which is West Africa like Nigeria, Sierra Leone, Liberia, and Guinea, where this virus is persistently present. Also, pregnant women, they are at increased risk of severe illnesses, fetal loss, and maternal mortality. And also, individuals with that are immunocompromised, like individuals with HIV/AIDS, organ transplant recipients, and patients that are undergoing chemotherapy. And also healthcare workers, especially those in infectious disease wards and laboratories who handle patient care and specimens. At the clinic, the people that are most at risk are, people that have travel history. That is, the pe those who just have visited endemic regions and present with fever, malaise, or unexplained hemorrhagic symptoms. Also, healthcare workers handling specimens or patient care, they have a high risk because most times they have inadequate PPE or and which makes them susceptible. Also, family members of infected individuals, particularly those in close contact with the patient's bodily fluids or contaminated materials. So, the infections agent for Lassa fever is the single-stranded RNA virus from the Arenaviridae family, which is the etiological agent of Lassa fever. And the risk factors of Lassa fever are exposure to rodents, contaminated food, water or surfaces in endemic areas, poor sanitation and overcrowded living conditions, increasing human-rodent contact, and also healthcare exposure without proper PPE, particularly in low resource settings where isolation and containment are challenging. Where should testing be done? For testing for Lassa fever should be done in high containment labs due to the high risk of transmission. And also to diagnose Lassa fever, a provider can ask for blood tests, throat swabs, urine analysis, and lumbar puncture. The infectious window for Lassa fever is 2 to 21 days after exposure before symptoms do appear. Um, and also, the virus is present in bodily fluids throughout the active infection. For the infectious window, it says when it is symptomatic. The onset of the disease is usually gradual, starting with fever, general weakness, headache, and malaise. After a few days, sore throat, muscle pains, chest pains, nausea, vomiting, diarrhea, cough, and abdominal pain may follow. As this disease progresses in severe cases, facial swelling, fluid in the lung cavity, bleeding from the mouth, nose, vagina, or gastrointestinal tract, and low blood pressure may develop. Shock, seizures, tremor, disorientation, and coma may be seen in the later stages. Among hospitalized patients, approximately 15% die of Lassa fever disease. In fatal cases, death usually occurs within 14 days of symptoms onset. During pregnancy, Lassa fever can cause high maternal and fetal mortality, especially late in pregnancies. So Lassa fever can persist in urine and semen for several weeks, necessitating extended precautions. So Lassa fever is transmitted through rodent urine and feces and direct contact with somebody that already has the Lassa virus already, an aerosol transmission. And these are ways to protect staff from Lassa fever. Strict use of personal protective equipment, that is use of gloves, N95 mask, face shields, gowns, and eye protections, goggles, and hygiene protocols, frequent washing of the hands with soap and water and alcohol-based hand rubs, disinfection measures, regular sanitation of eye touch surfaces and patient care equipment, isolation precautions, place suspected cases in negative pressure isolation rooms if available, safe handling and disposal of medical waste to protect environmental contamination. Also, the room is sanitized through sodium hypochlorite, which is the bleach solution, hydrogen peroxide vapor, and paracetic acid-based disinfectants. Lassa fever is so important because it has a high morbidity and mortality rate. Case fatality rates range from 1 to 15% with higher rate in hospitalized patients. And severe complication could include, multi-organ failure, hemorrhagic symptoms, neurological impairment, and pregnancy-related mortality. Also, for Lassa fever, risk of hospital outbreaks due to delayed diagnosis and insufficient infection control, and the need for rapid identification and isolation to reduce transmission and improve patient outcomes. So I'll just say that Lassa fever is a very serious, very viral hemorrhagic disease with a high public health implications. Early recognition, rapid testing, and strict infection control measures are crucial in managing the outbreak. Healthcare workers must remain vigilant, adhere to strict PPE guidelines, and implement sterilization protocols. Thank you.